Gallstones are like tiny pebbles that form in your gallbladder. The gallbladder is a small organ under your liver. It stores bile, a fluid that helps with digestion. Gallstones form when there's an imbalance in the substances that make up bile. Often gallstones don't cause any symptoms and go unnoticed. You might not even know they're there. However, sometimes gallstones can cause sudden and intense pain. This pain usually occurs in the upper right abdomen. If a gallstone blocks a bile duct, it can lead to serious complications. Complications may include inflammation, infection, or even blockage of the pancreas. These situations require prompt medical attention. Understanding the causes and symptoms of gallstones is crucial for early detection and treatment. For some people with gallstones, medication can offer a non-surgical treatment option, providing a less invasive alternative to surgery. This is called oral dissolution therapy, a method that uses specific medications to target gallstones. It involves taking medications that help dissolve cholesterol gallstones, which are formed from hardened cholesterol deposits. Cholesterol gallstones are the most common type of gallstone, accounting for the majority of cases. Two commonly used medications are ursodiol, also known as Actigol, and chenodiol, also known as Kenix, both of which are effective in breaking down these stones. These medications work by reducing the amount of cholesterol in bile, which is a digestive fluid produced by the liver. This helps gradually dissolve the gallstones over time, making them smaller and easier to pass. The length of treatment varies depending on the size and number of gallstones, as well as the patient's overall health. It can take several months or even years for the stones to completely dissolve, requiring patience and consistent medication use. While oral dissolution therapy can be effective, there is a chance that gallstones may return after treatment. This is called recurrence, and it can happen if the underlying conditions that cause the stones are not addressed. Your doctor will discuss the likelihood of recurrence based on your individual case and may recommend lifestyle changes or additional treatments to prevent future gallstones. Endoscopic retrograde cholangiopancreatography, or ERCP, is a specialized medical procedure used to diagnose and treat conditions related to the bile ducts, including gallstones that have moved into the bile duct. The bile duct is a crucial part of the digestive system, carrying bile from the liver and gallbladder to the small intestine, aiding in digestion. During an ERCP procedure, a doctor uses a thin, flexible tube called an endoscope, which is equipped with a light and camera. The endoscope is carefully inserted through the mouth, down the esophagus, and into the small intestine, allowing the doctor to see inside the digestive tract. From this position, the doctor can access the bile duct and perform necessary treatments. Once the endoscope is in place, specialized instruments can be passed through it to remove the gallstones or perform other interventions. ERCP is considered a minimally invasive procedure, meaning it doesn't require large incisions, reducing the risk of complications. This minimally invasive approach results in less pain and a faster recovery time for patients compared to traditional surgery. ERCP is an effective and reliable way to remove gallstones from the bile duct, relieve blockages, and improve patient outcomes. Shockwave lithotripsy, or SWL, is another non-surgical option for treating gallstones. This method uses high-energy sound waves to break up the gallstones into smaller pieces. These smaller pieces can then pass through the bile duct and out of the body naturally. During SWL, you lie on a table while a machine delivers shock waves to your body. The sound waves are targeted at the gallstones using imaging techniques like ultrasound. SWL is a non-invasive procedure, meaning it doesn't involve any incisions. However, it's not as commonly used as other non-surgical treatments. This is because it's not effective for all types of gallstones. SWL is often combined with oral dissolution therapy to further break down the gallstone fragments. When deciding between non-surgical and surgical treatments for gallstones, several factors come into play. It's crucial to understand the differences and implications of each option. Non-surgical treatments are generally preferred for patients with small gallstones, as these methods are less invasive and often come with fewer risks. They are ideal for those who are not experiencing severe symptoms, allowing for a more comfortable and less stressful treatment process. Non-surgical options are also considered for patients who are at higher risk for complications from surgery, such as the elderly or those with certain medical conditions. Surgery, on the other hand, might be recommended for patients with large gallstones, recurrent gallstones, or those who experience complications from gallstones, such as infections or blockages. Surgical treatments can provide a more permanent solution, especially in cases where non-surgical methods have failed or are not suitable. The decision of whether to pursue non-surgical or surgical treatment is a personalized one, tailored to each patient's unique needs and medical history. Your doctor will consider your individual circumstances, including your overall health, medical history, and any underlying conditions. Factors such as your overall health, the size and location of your gallstones, and your personal preference will all play a role in the decision-making process. The size and location of your gallstones are critical in determining the most effective treatment approach. They will discuss the risks and benefits of each option to help you make an informed decision, ensuring you understand all potential outcomes. It's important to have open and honest communication with your doctor, sharing all your concerns and questions. This collaborative approach will help determine the best course of treatment for your specific situation, giving you confidence in your healthcare journey.